The Russian Federation is the largest country in the world and has the world's largest reserve of a host of natural and other energy resources. It spans 11 time zones, enjoys a diverse landscape and climate, and has a population of 142 million people who represent 160 ethnic groups. Since 1991, the Russian Federation has operated as a representative democracy with free education and free universal health care. Despite this, human rights granted by their constitution are still constantly abused. Average life expectancy in Russia is 65, and the reported average salary in 2008 was $640 a month. More than 14% of the population lives below the poverty line. Russia has one of the highest child mortality rates in Eastern Europe, with 15 deaths per 1,000 live births. Over 23,000 Russian children die each year due to poverty and a lack of social services in rural areas, from diarrhea, respiratory diseases, iron and iodine deficiency anemia, and low vaccination rates. Cambodia is similar to the size of Missouri and is one of the 10 nations of Southeast Asia. It has a population of about 14.4 million. More than 33% of Cambodians live below the poverty line, struggling to survive on less than $1 a day. Poverty is especially pervasive in rural areas and among children, who constitute more than half of the country's population. Cambodia has the highest under 5 mortality rates in the region at 141 deaths per 1,000 live births. Vaccine-preventable diseases, diarrhea, and respiratory infections are among the leading causes of childhood death. Maternal mortality is also high, and malnutrition affects more than 45% of Cambodian children. Mozambique is located on the coast of southeastern Africa and has a population of just over 21 million. The country struggles with social issues and is currently being monitored by the global community for known involvement with human trafficking and illicit drugs. Only about 40% of residents have access to basic health care and clean water. Mozambique has the 14th highest global child mortality rate with 168 deaths per 1,000 live births. Most of these deaths result from malaria, pneumonia, and diarrheal diseases. About 1.5 million Mozambique children are orphans, and about 470,000 have lost one or both parents to AIDS. Nearly 40% of children under 5 suffer from stunting as a result of chronic malnutrition. Food insecurity affects more than 800,000 residents, or about 4% of the population. The United States is the world's third largest country by size, covering about 3.7 million square miles with a population of 307 million. We are considered the most technologically powerful economy in the world. The United States enjoys a diverse population, climate, and geography, and an abundance of natural resources. We are the largest single emitter of carbon dioxide, and our citizens are the world's largest consumers of cocaine, heroin, and marijuana. Despite our global standing, nearly 12% of our citizens live below poverty level, and adequate access to health care remains an issue. With that said, almost all American children have access to clean drinking water, good sanitation, an abundance of food sources, immunization, education, and medical care. Because of these factors, child mortality rates are low, 8 deaths per 1,000 live births, and the majority of under 5 deaths are a result of accident, congenital defects, or cancer. Cuba is the largest country in the Caribbean and has a total land area of about 43,000 square miles. It has a population of 11.2 million people, and the primary language is Spanish. Cuba is a communist state. UNICEF indicates that recent severe droughts and disastrous hurricane events have hit Cuba hard, and that a tightening of the trade embargo against Cuba has limited shipments of money, food, and medicine, impacting infant and maternal mortality rates. Despite this, and despite being a third world country with a high level of poverty, Cuba has achieved the lowest rate of child mortality in the region, with 7 deaths per 1,000 live births. This has been achieved mostly through a multi-platform approach that includes nearly comprehensive sanitation, access to clean water, and primary education, in tandem with an aggressive vaccination and dietary supplement campaign. Because of these factors, accidental death is the leading cause of childhood mortality in Cuba. Iraq is a Middle Eastern country bordering the Persian Gulf between Kuwait and Iran. The country is mostly desert and has a population of 29 million. 25 years of sanctions and conflict has made Iraq a difficult and dangerous place to be a child. Widespread insecurity since the 2003 war has eroded social services, shattered infrastructure and families, drained the country of skilled doctors and teachers, and fractured once peaceful communities. Tens of thousands of children have lost parents, brothers, and sisters to violence, and many are left orphaned, traumatized, and physically damaged. The country's under 5 mortality rate is 44 deaths per 1,000 live births, and 1 in 5 Iraqi children show signs of stunted growth, indicating long-term nutritional problems. Diarrheal disease rates are also high because of safe drinking water shortages, as only about 40% of Iraqi children have access to clean drinking water. India has a population of just over 1 billion people and supports more than 15% of the world's population. Almost 40% of India's residents are younger than 15. It is also the world's largest Muslim population. Child mortality remains high at 72 deaths per 1,000 live births. Children in India continue to lose their lives to vaccine-preventable diseases such as measles, which remains the biggest killer. Around 46% of children under 3 are too small for their age, 47% are underweight, and at least 16% show signs of wasting. Many are severely malnourished, with anemia affecting 74% of children under age 3. Nigeria is located in western Africa, bordering the Gulf of Guinea between Benin and Cameroon. The country is slightly bigger than twice the size of California, with a population of 150 million people who represent more than 250 ethnic groups. English is the official language of Nigeria, and only 68% of the population can read and write. 70% of the population lives below the poverty line. Average life expectancy for a Nigerian is 46. The child mortality rate is exceptionally high for children under age 5, with 189 deaths per 1,000 live births. Malaria is the leading child killer in this age range, causing 250,000 deaths each year. A variety of neonatal causes lead to the annual death of about 3.7 million newborns during their first month of life. Neonatal deaths comprise 37% of all child deaths, half of which occur in India, Nigeria, Democratic Republic of Congo, Pakistan, and China. The World Health Organization cites undernutrition as the largest single contributor to premature death, but low birth weight, often associated with the mother being underweight as well, is also a significant stressor. There are more than 150 million reported cases of childhood pneumonia or acute respiratory infection globally, and nearly 2 million children under age 5 lose their lives to this infection. In fact, pneumonia is the leading disease-borne cause of death for children under age 5, more than AIDS, malaria, and measles combined, and accounts for 19% of childhood deaths. 95% of all pneumonia infections in children occur in developing countries where poor children's immune systems are already weakened by malnutrition and other diseases. Diarrhea in the form of cholera, shigellosis, rotavirus, typhoid, dysentery, and other diarrheal diseases kill nearly 2 million children globally each year and account for 16% of childhood deaths in our target age group. Children are more vulnerable to diarrhea because their immune systems are less able to respond effectively to the severe dehydration that accompanies the illness. And because millions of children live in communities with little or no access to safe water and adequate sanitation, prevention of food and waterborne diarrheal infections is extremely difficult. According to the Global Health Council, maternal and child undernutrition, too few nutrients to sustain growth and development, contributes to 3.5 million deaths each year and is responsible for about 11% of the global disease burden. In children under 5 years of age, just over 2 million deaths are directly attributed to stunting, depressed growth, severe wasting, depressed weight, restricted intrauterine growth, and vitamin A and zinc deficiencies. Malnutrition among children is rising in Africa, but remains most pervasive in Asia. In February 1993, South African photojournalist Kevin Carter travels to the Sudan to cover the relentless East African famine. At one feeding station, he finds people so weakened by hunger they are dying at a rate of 20 per hour. As he photographed their hollow eyes and bloated bellies, Carter hears a soft whimpering in the bush. Investigating, he finds a tiny girl trying to make her way to the feeding center. Carter crouches, readying his camera. Suddenly, a vulture lands nearby. Carter waits, the vulture waits. Carter takes his photographs, shoos the vulture away, and sits under a tree and cries. He never learns the fate of the little girl. Now for the good news. According to UNICEF and its partners, there have been a landmark reduction in under 5 deaths worldwide, and every region has made progress in reducing the under 5 mortality rate. The most rapid declines between 1990 and 2006 were found in Latin America and the Caribbean, Central and Eastern Europe and the Commonwealth of Independent States, and East Asia and the Pacific. In the past, most child deaths occurred in Asia, but falling under 5 mortality in Asia has helped to fuel global decline. Today, around 50% of child deaths occur in sub-Saharan Africa, and if this trend continues, by 2015, sub-Saharan Africa will account for almost 60% of all under 5 deaths. Despite this overall trend, there have been significant progress made in some countries in that region. The highest rates of child mortality are still found in West and Central African nations and in Southern Africa, where hard-won gains in child survival have been undermined by the spread of HIV and AIDS. With continued support for child health initiatives, increased funding, and expanded partnerships, further global and regional progress on child survival is possible. Indeed, it is critical. The lives of the world's youngest and most vulnerable children are at stake.
Romeo loved Juliet, Juliet he felt the same. When he put his arms around her, he said, Julie, baby, you're my flame, thou givest fever